I use HealthPathways because as a GP, I'm often time poor, and I find HealthPathways a very useful one-stop shop to get all the clinical information I need quickly, and it helps me then to advocate for my patients so I can get the best outcome for them.
I find the information that's under HealthPathways can be really useful, particularly if you've got a patient there, you're not too sure what's going on, you can pull up, it goes through all of the red flags to make sure that you're not missing anything, and gives you a really good guide on how to escalate things if you need to, and also at what points you might need to escalate that.
I find it really useful that the information is quite concise, but there are a lot of hyperlinks within the documents that you can then go to for further information. There's also lots of handy contact numbers and references where you can actually get advice without trying to search where can I get that advice from.
I find it actually quite beneficial pulling it up when the patient's sitting next to me, because they too can also see that we're following what the current evidence-based guidelines are, what the pharmacological management might be, all the right investigations, and I find that it can often help to justify why we are or aren't doing certain things before we actually escalate to specialist care.
HealthPathways can be a useful tool for other members of the clinical team, particularly the nurses, and also it's a great teaching tool for my registrars and medical students.
As a newly fellow GP, I found it particularly helpful when I was studying and when I was trying to get my head around all of the different things going on, all the local resources, all of the networks available. I would encourage any GP who hasn't started using HealthPathways to get on board and have a look at what's available. You can pull it up and it's actually got information that's been created by our local consultants in those areas. It's very specific to how our outpatient departments work.
It's something new, and I know we're all averse to using new things, but I can assure you, you're going to save some time, and more importantly, you're going to be advocating for your patients in the best way possible.